Hi everybody, my name is Joy Hodge, and in this video today we're going over one of the modified Thomas tests focusing on the iliopsoas, a uniarticular hip flexor. The motion that's going to be assessed is hip extension in the sagittal plane. This test helps identify hip flexor tightness that can limit extension or cause anterior pelvic tilt and lumbar strain. The participant is going to lay at the edge of the table, tush hanging off of it, just like the bilateral hip and knee flexion test. Then they are going to roll back, hugging one knee to the chest, while the test leg is going to remain flexed, then slowly hang freely off the edge of the table. You also have to make sure that the pelvis stays neutral and the lower back stays flat. Now, if the thigh is level with the table, the iliopsoas length is normal. If it stays lifted above the table, that shows hip flexor tightness. Now, go ahead, grab this leg, and now bring your knee, keep your knee flexed, bring it down. Either when it passes the table or when you feel tightness. Why is this important? Well, limited hip extension here can lead to tight hip flexors, lower back pain, and poor movement efficiency. For athletes, having a good hip extension supports stride length and explosive hip drive. The key anchors are keeping the lumbar spine stable, the pelvis neutral, and maintaining the opposite knee pulled to the chest, creating a posterior pelvic tilt. This test is a qualitative test to see if the thigh can stay level with the table and not go above the table. If it goes above the table, we're in the red zone. Alrighty folks, that's the modified Thomas test for the iliopsoas, assessing hip extension and lumbopelvic control. See you next time.